produced as magnesium ATP complex. Therefore, magnesium is essential for energy production. It also activates enzymes that are involved in carbohydrate metabolism, protein metabolism, nucleic acid synthesis. So by that, it means that magnesium supports DNA repair, DNA replication, and RNA transcription. Very important in cancer genesis if magnesium is deficient. Without adequate magnesium, cellular metabolism slows down or practically not feasible. Energy production decreases and tissue become more susceptible to oxidative damage. Let's briefly look at the system biology, magnesium system physiology. Magnesium affects nearly every organ system in the body. If you go to the neuromuscular system, magnesium regulates the transmission and muscle, magnesium regulates nerve transmission and muscle contraction. That is at the neuromuscular system. If you go to the cardiovascular system, you find out that magnesium helps to maintain normal cardiac rhythm and vascular tone. If you go to the general body metabolism, you find that magnesium supports insulin signaling and glucose utilization. I can see that our slide has already come up. So for a moment, if you can hear me, I'm on slide 9. So that is magnesium system physiology. So yes, after biochemical function of magnesium. Magnesium system, so that is slide 9. So you are correct. So the cardiovascular system is maintain normal cardiac rhythm, and in metabolism, magnesium supports insulin signaling and glucose utilization. In bone, it contributes to mineralization of the bones. In the nervous system, magnesium regulates NMDA receptor, that is N-methyl D-aspartate receptor. This is the hormone that helps influence learning, memory, and neural excitability. This widespread function of magnesium explains why magnesium deficiency can produce diverse clinical manifestations. Let's go to the next slide, that is slide 10. Magnesium as an anti-inflammatory nutrient.
Hello, Dr. Yomi. Hey, can anyone hear me?
I can hear you, but I can't hear the presenter.
Okay. I think our network had a cut there. Let's give her a few minutes to reconnect back to the meeting.
Hello, can you hear me? I think the network got me out.
Yeah, we
Yes,
can hear you.
thank you.
I hear you now.
Okay, okay, thank you. Hardly will you see any disease without inflammation. Most of diseases, especially chronic disease, maintain their progression via inflammation. So, magnesium deficiency promotes oxidative stress, endothelial dysfunction, and inflammatory cycle. If you lack magnesium, all these things will start happening. Study demonstrated that elevated level of inflammatory markers such as CRP, that is the first thing you can actually note, you can find from lab tests. CRP normally increase during inflammation. TNF-alpha, interleukin-6, all are elevated in magnesium deficient individual. These inflammatory processes contribute to diabetes, hypertension, cardiovascular diseases, and possibly cancer progression. What this means is that if you lack magnesium, all these diseases can start on their own without any other factors. So if you now have other factors that are contributing to them, then it is an added advantage. Therefore, magnesium may serve as a nutritional tool for reducing chronic inflammation, coupled with other measures you can take to reduce chronic inflammation. Then let's go to slide 12. Recommended dietary. Recommended dietary allowance. That is after magnesium as anti-inflammatory nutrient. So let me go on. Chronic inflammation is recommended dietary allowance. Recommended dietary allowance vary according to age, sex, and the physiological state. Normally, we recommend between 400 to 420 milligrams for adult male or men, while adult women require about 310 to 320 milligrams daily. Either you get it from food or as supplement. Requirement increases during pregnancy because fetal growth required magnesium also. So there's increased demand of magnesium during pregnancy and also lactation. Understanding this recommendation, clinicians identify patients that are at risk and patients that need to increase their intake. Slide 13, I will quickly move from slide 13 to slide 20, talking about magnesium deficiency and deficiency cascade. So normally, magnesium deficiency does not just occur suddenly. You cannot just wake up in one day and be deficient in magnesium. It develops progressively through several stages, and we can easily look at them as I recommended. Initially, when your intake of magnesium is poor, if you are not taking any of the listed food that contain magnesium, that is where your journey starts. As deficiency progresses, intracellular magnesium stores become depleted over time. Then metabolic enzymes begin to malfunction. This will result in impaired ATP production, insulin signaling, and over time, you can have general organ dysfunction, followed by chronic inflammation and oxidative stress. So, because of our time, I try to group the journey as magnesium deficiency cascade from slide 14 upward up to slide 20, so that at each stage you will see as mere deficiency, your lack of magnesium will lead progressively to a beginning of a lifelong disease. So the deficiency, as I said, will not just happen it starts from your inability to pay attention to the food you take. You must intentionally take food that contain all these, the compound that we are, the food substance that we are mentioned. So metabolic enzymes begin to malfunction as deficiency progresses. This will result in impaired ATP production, insulin signaling, and over time, organ dysfunction will develop, followed by chronic inflammation and oxidative stress. Eventually, there will be the overt disease. So the disease will manifest. So this cascade can help us understand why deficiency is both the causes and the consequence of chronic illnesses. So you can see the clinical feature of magnesium deficiency as we see in the slide that we have on our screen. If you are deficient in magnesium, at neurological level, there will be fatigue, muscle cramp, tremor, and seizure. These are the primary signs or symptoms that you can notice and start suspecting magnesium deficiency. And if that one progresses, you can start having cardiovascular effect or cardiovascular symptoms. Magnesium deficiency can lead to a very dangerous arrhythmia. There is a type of arrhythmia we call torsade de Ponty. That arrhythmia is life-threatening arrhythmia. And the gold standard treatment for that type of arrhythmia is magnesium sulfate. So it is magnesium that is recommended. So as the deficiency progresses, the patient can develop hypertension. You can have metabolic diseases that will develop from insulin resistance to overt diabetes, full-fledged diabetic development. You can have problem at psychiatric level where the patient will develop anxiety, depression, and sleep disturbance. And over time, this one will progress to full diseases. So, and we've seen from the next slide the possible cascade that I mentioned from stage 1 to stage 6. If you see this stage 1, you see that it started from inadequate magnesium intake. And as at this time, if you share the magnesium level, you will still find it at normal level. At normal level, that is about, the magnesium will still be above 1.7 milligram. So, milligram per dl. As at that level, the patient is still normal. And you may not be able to see the symptom. Next slide, please. So you proceed to stage 2. At this stage, magnesium intake becomes insufficient and intracellular magnesium level begin to decline. So because raw magnesium represents approximately 1% of the total body magnesium, so at this stage, the serum magnesium level will still be normal, but the effect will have started on multiple tissues and organs within the body. Next slide, please. Then you move to stage 3. At this level, the enzyme, because we said magnesium affects more than 600 enzymatic reactions, there will be effect on all these biochemical enzymes, and whatever they affect will also be developing malfunction. Next slide. So at stage 4, at this stage, you see that the effect will become more visible across multiple organs. You have metabolic defect, you have cardiovascular defect, you have neurological defect, and you have electrolyte disturbance. All these systems at a time will start developing problems just from the deficiency of one single element. Next slide, please. Next slide. So at stage 5, okay, at stage 5, magnesium deficiency promotes low-grade systemic inflammation. And as I said, inflammation is like a fuel that spread the progression of this disease. Inflammation becomes a central driver of disease progression. So stage 5 is very, very significant as the deficiency continues. Stage 6, which is the last stage. Next slide, please. As I see, we say the development of chronic diseases, full development of chronic disease. So the cumulative physiological stress leads to overt diseases. So, and at this stage, you can assess the deficiency disease in the lab, and you can see the physical symptom. If the patient is pregnant, so many things can happen. Deficiency of magnesium is one of the suspects to some of the problem in pregnancy. Hypertension in pregnancy for those people that were not initially hypertensive, gestational hypertension, and preeclampsia and eclampsia. In short, in preeclampsia and eclampsia, the first line treatment for especially eclampsia, the first line to arrest seizure during eclampsia, the first line is magnesium sulfate. So magnesium is still the one that will solve the problem because it corrects multiple areas in the disease. So that is very much better than all antiseizure that you can use in eclampsia. Next slide, please. Let's go to slide 21 because of our time. Magnesium and diabetes. Magnesium and diabetes. Okay, good. Magnesium and diabetes. Magnesium plays a critical role in insulin receptor activation and glucose transport. So low magnesium level is consistently associated with insulin resistance, poor glycemic control, and type 2 diabetes. What we are saying in essence is that magnesium deficiency can lead to diabetes. Simple. So several studies have demonstrated, several studies have demonstrated that demonstrated improvement in fasting insulin, in glycosylated hemoglobin, and insulin sensitivity following magnesium supplementation. It is not that we are going to use only magnesium to treat diabetes, no, but magnesium can be an adjunct to the treatment. This makes magnesium an important consideration in diabetes management. Next slide, please. Magnesium and hypertension. Magnesium and hypertension. Magnesium promotes vasodilation by relaxing vascular smooth muscle. The importance of magnesium in prevention and treatment of hypertension is you cannot overemphasize it. I have seen it, and I know that if an hypertensive patient add magnesium to their regimen, they will see improvement in the normal regimen they have been using. It also antagonizes calcium. Naturally, magnesium is a natural calcium antagonist. So on its own, that's like the calcium channel blocker, which helps reduces excessive vascular constriction. Meta-analysis have shown that modest reduction in systolic and diastolic blood pressure following magnesium supplementation, especially in deficient individuals. Therefore, magnesium can serve as a useful adjunct in hypertension management. Let's go to the next slide, please. That is magnesium and cardiovascular disease. Magnesium has several cardioprotective effects, as we have seen in the previous slide. It stabilizes cardiac electrical activities because it affects the membrane conductivity. It reduces platelet aggregation, improves endothelial function, and supports vascular health. Normally, magnesium can help prevent development of coronary artery disease. Higher dietary magnesium intake has been associated with lower risk of stroke, coronary artery disease, and heart failure. This finding highlights the cardiovascular importance of maintaining adequate magnesium status. So what all this means is that if we pay a particular attention to the magnesium content of what we consume, we are invariably preventing or even treating most of these chronic diseases. Let's go to slide 24, magnesium. before we go to magnesium and chronic disease. Okay, let's look at magnesium and chronic disease. Magnesium is imagined as a protective factor in chronic diseases and in chronic kidney diseases. Evidence suggests that it may reduce vascular calcification in chronic diseases and it can improve endothelial function in chronic disease. However, because kidney function regulates magnesium excretion, as we said earlier, the kidney is involved in the regulation of magnesium. The kidney is the one that controls when you want to have excess magnesium in the body. So, because kidney function regulates magnesium excretion, so supplementation must be approached cautiously in chronic diseases. Because if you supplement a chronic disease patient without proper monitoring, you can have hypermagnesiemia that you may not want. So, next slide, please. Magnesium in critical care. Hypomagnesemia is an extremely common issue in ICU. Most of the patients that come into ICU and most of the patients that are there, most of the time research has shown that majority, I don't want to say all of them, are deficient in magnesium. And over time, as they stay within the ICU, the feeding and the complication of their diseases tend to predispose them to magnesium deficiency, and this worsens the outcome of whatever they are managing in the ICU. So it is associated with arrhythmia, prolonged ICU stay, ventilator dependence, and increased mortality. That is magnesium deficiency. So it means that routine magnesium monitoring should be considered in patients with sepsis. That's what you have as a common problem in ICU. Patients with burns, patients with trauma, patients with major surgery. So correction of this deficiency may improve the outcome and reduce complication in ICU. Next slide, please. Magnesium and cancer. Magnesium, as we saw in the introduction to the lecture, supports DNA repair and genomic stability. The deficiency may contribute to oxidative DNA damage and chronic inflammation, creating an environment favorable for carcinogenesis. So, while current evidence is promising, this area of cancer is still an area that we have so many research going on magnesium. So more studies are still needed before routine magnesium supplementation can be recommended specifically for cancer prevention or treatment. So we still need more study in this area, but the few that we have, some have shown evidence in helping in cancer, while some did not show evidence. So we still need more study in that area. Then we want to, the next slide, please. We find out that magnesium also affects mental health. Deficiency of magnesium causes migraine. You can see anxiety. It causes some people are prone to depression. Some will have loss of sleep, some fatigue, all as a result of magnesium deficiency. Next slide. So, magnesium supplement. Let's look at the supplement. We have different supplements in the market. Not all supplements are same. We have different formulations. As I'm talking, I know that some pharmacy will have magnesium in their shelf or counter. So different formulations have different bioavailability. So in clinical application, there are some that we know that they have high bioavailability. For example, magnesium glycinate is often preferred for anxiety, for sleep disorder because of its excellent absorption and GIT tolerance. So as you see in this slide, the bioavailability, the absorption, GIT tolerance, all this one affect the choice of magnesium. Magnesium citrate is commonly used in constipation. Magnesium sulfate is used intravenously in emergency cases. Just as I mentioned before, you use magnesium sulfate in eclampsia, that is the IV form. So magnesium sulfate is not even considered to be a supplement. Magnesium sulfate is a drug. So as we see from the slide, we have the salt form of magnesium, and we have special magnesium formulation. As I said before, magnesium glycinate, magnesium taurate, they have high bioavailability. And we also have some uncommon form and more expensive form. But this special form, like magnesium threonate and magnesium orotate, they have some special uses because they have been proven to penetrate blood-brain barriers. So some of them have been under study in dementia and some other brain issue. Next slide, please. So this is still saying or emphasizing what I said. Some have high bioavailability, some have low bioavailability, and this determines their function. Next slide. I want to look at magnesium safety and toxicity. Is it safe to supplement with magnesium in everybody, or we just have some selected individual? Magnesium supplementation is generally safe, very safe. If you compare all the elements that I have mentioned before now, from sodium, potassium, calcium, and magnesium happen to be the safest among them. So you don't really have problem with supplementation except in patients with renal failure or kidney disease. However, excessive magnesium accumulation may occur in patients with kidney impairment. So toxicity may occur in this patient. So unfortunately, when we have cases of toxicity, we use calcium gluconate as magnesium antagonist, and this have been used in many clinical settings where they use IV magnesium sulfate. So, and when you want to use it, you need to know the current patient serum magnesium. I mean, before you institute whatever you want to use. So next slide, please. Let's go to magnesium as a bridge between medicine and nutrition. Magnesium as a bridge between medicine and nutrition. In medicine, normally traditional medicine, we practice treatment and disease management. That is what most of our hospitals are for. We don't practice prevention. But in nutrition, we recommend most of our nutritional agents to prevent some possible diseases, and we also use it for dietary optimization. But magnesium serves in both terms, in both places. Next slide, please. So our presentation central message is that magnesium represents a bridge between nutrition and medicine. While nutrition focuses on prevention and health optimization, medicine focuses on diagnosis and treatment. So magnesium intercepts both disciplines by supporting prevention at the same time, serving as adjunct therapy and contributing to chronic disease management. So we use integrated approach in future healthcare. We can start adding magnesium to our normal treatment procedure, and we are going to gain, we are not going to lose anything. Before I proceed, I want to look at these few clinical cases. The first is a 58-year-old diabetes patient. It's a non-diabetes patient, hypertensive at the same time, with all those medical issues that you can see on the slide. The patient is on the drug that I have. One of the slides, because of our time, I did not specifically mention some of the causes of the deficiency. Some drugs cause magnesium deficiency. A good number of them, some of our antidiabetics, including metformin, drugs, PPI, some antibiotics like aminoglycoside, all of them causes magnesium deficiency. So let's look at this patient. This patient is on metformin. This patient is on hydrochlorothiazide. Most of the diuretics also cause magnesium deficiency. So if you look at the complaint, the patient has persistent fatigue, muscle cramp, poor sleep, and occasional palpitation and poor BP control. So next slide. When they did the lab work, they find out that the patient has a serum magnesium deficiency. And even if you do serum magnesium assessment and you find out that it is normal, that does not really mean that the patient has total body magnesium that is normal. So if you now find serum magnesium that is low, that has given you another message entirely that the total body magnesium is low. Hello? Hello?
Yes, ma, please, because of our time, we'll appreciate if you can round up faster, ma.
Okay. So we see the intervention from the slide. You can go through and see how we were able to supplement again with magnesium, and the patient come up. We have a very good improvement. So I am almost in the conclusive aspect. Thank you, my moderator. So as we conclude, magnesium should no longer be viewed as a mere another mineral element. It is a master regulator of cellular function and a critical mediator of health and disease. So recognizing, preventing, and correcting magnesium deficiency offer opportunity to improve outcome in diabetes patients, hypertensive patient, cardiovascular disease, kidney disease, critical illness, and many other disease conditions. So, before I close, I have, if you want to assess magnesium in patient, the various steps that you can take, you have it on the slide. And the various field of research that we still have that needed to be explored under magnesium. I also put it in the slide. So by that, I come to the end of the lecture tonight. Thank you. Over to you, my moderator.
Thank you very much, Dr. Yomi Oladele, for that beautiful presentation. We really appreciate the effort and the time you put into preparing this lecture for us. In the course of the lecture, we benefited. You've reminded us of what magnesium is, some of the importance of magnesium in the biological system. One of which is that it helps to stabilize the ATP, the energy currency of the system. You also spoke about the importance of magnesium as an anti-inflammatory nutrient, daily requirements according to age and sex, and then some of the clinical features and symptoms that we can observe in the deficiency of magnesium. Thank you very much, Ma, for once again for the time, the effort you put into preparing the lecture. We really appreciate it. Now to the house, if anybody has any question, very, very briefly, please, because our time is fast spent, you can just raise your hand so that Dr. Yomi will answer your question, please. Very, very briefly.
Hello, sorry, good evening. Sorry, I didn't raise my hand. I didn't see where to raise it. I cannot find it electronically. Good evening.
Good evening, sir.
Okay. Sorry, I joined this meeting a bit late, but I've done so much. I tried to join since I was being pushed out, but after some time I was able to join. The little time that I've spent here, almost 20 minutes ago, I discovered that I've gained so much. And what I want to say now is more like contribution. Though when I was looking at this lecture, I discovered the photograph there is supposed to be a male that is to present, but I keep hearing the moderator saying ma. That means it's a female that is presenting this lecture. However,
No,
I
sir.
want
That is the voice. It's a male.
okay, but your moderator okay, so sorry for that. Thank you
sir.
so much.
Thank you,
You
sir.
have done excellently well. You know your onions. I must say, I've learned so much, but mine is more like a testimony. I've been a community clinical pharmacist for about 26 years now, and I have a lot of experiences because even before graduating from pharmacy school, I had to do a lot of IT, and I also worked in many community pharmacies. I now have a lot of experience when it comes to direct patient care. One very important thing I found out is a product that when you look at the label, you will see magnesium. Okay, you see calcium first. And then after calcium, you see magnesium, vitamin D, and zinc. I discovered that when some persons complain to me about maybe some musculoskeletal pains and the rest of them, a lot of uh, symptoms like that, even palpitations, as you mentioned. I discovered that whenever I give Calcimax, which has magnesium, calcium, and whatever, I find out that I have a very good result. But even when I'm suspecting the problem may be due to calcium related, and we give calcium alone without magnesium, we do not get good results. But the moment you give them Calcimax, which has magnesium, it works like a miracle drug. So as we are teaching this night, I was just saying what this person is teaching, it's like he's now testifying or proving all that I have seen in practice. And I think again, because I'm aware that many persons that have stroke, a lot of times we, the clinicians, start looking at their BP and the rest, and we continue to link the stroke to maybe high BP and the rest. But I know that a very good number of stroke patients is due to palpitations. And from what you're saying, a deficiency of magnesium can also lead to palpitations. And even in hypertension, you have told us how it can be used, and other, even diabetes, due to even drugs used in diabetes. So I think I've learned a lot. And you have also summarized when you said even magnesium supplementation is not bad. Sorry, I'm not your moderator, I'm not summarizing, but I'm
Yes,
just
sir.
and linking it to the way you are teaching. I'm just understanding everything and saying why we can even do supplementation without being afraid, because you have said even potassium, calcium, and the rest, magnesium appear to be the safest. So I want to thank you. And in fact, I feel for anybody who is not in this lecture this night. And I want to thank you for my mama for inviting me. I had a lot to do this night, but I said no. Let me just honor her invitation and attend this lecture. And I've gained so much. I want to thank you, our presenter. I want to thank you, Nutrition Support Pharmacist of Nigeria. I want to thank you, Mr. Moderator, and every other pharmacist and any other person at this meeting this night. Thank you so much. God bless
Thank you,
you.
sir. God bless you, sir. Thanks so much, sir. Thank you for your contribution, sir.
I have a question, please,
Thank-
if I may be allowed.
Go on, man.
Okay,
Go on.
lastly, please go on.
Okay, yeah, Pharmacist Zainab Sharif. I want to commend the presenter for an excellent presentation, very simplified, very well understood, and thought-provoking. My question, where I was trying to look for some explanation, is interaction between magnesium and other medications, because we have seen the critical role magnesium plays in management of chronic ailments. So, and then most cases we have supplements, like we have said. If you go to all the shelves in community pharmacy, we have magnesium glycinate, so all those different types. So when you are prescribing that, how do you tell your patients to take it? Automatically, that means any community pharmacist can recommend a magnesium supplement or food that are rich in magnesium. So how do you tell them to take it? Cashew is very easy. It's a nut or almond. They can take it in different forms. But when you have the supplement now, how will you tell your patient to take it? And then another thing is that there should be always a good collaboration between pharmacists, because we are talking about clinical pharmacists now. And you know that there are nutritionists in all hospitals. How do you collaborate for you to share these ideas? And for us pharmacists, it's thought-provoking because micronutrients have been shown to play. We
Thanks
all
so
know
much,
about
man. God bless you, man.
micronutrients. Yes, micronutrients have been known to play a critical role. Now we are bringing it out to the front burner. So it's very important that all pharmacists are knowledgeable in micronutrients and be able to manage it and be able to include it in our medications. In that case, we will become super duper. So this is just my information and also my need for you to talk about that medication interaction and safety, because you see some all over. You now see magnesium glycinate is so expensive to buy because most of us are recommended for critical role in managing the nervous system and neurotic disorder. So even enhance with other things like B6 or B12. And then, of course, at times melatonin to promote sleep. So could you just say 1 minute on that so that we can get well done, pharmacists. I really appreciate your presentation. God bless you.
Thank you, ma. Thank you, ma. So to briefly answer your question, the first thing is that if you want to embark, if you want normally for everybody, as I said, intentionally, we must take step to take magnesium containing substance for everybody at all age, especially the population that have the tendency to lack magnesium. And what are this population? The elderly people, anybody from above 40, you have that tendency. Then pregnant women, they need it. All patients that have chronic disease are suspect of magnesium deficiency, even without you doing any test. Every ICU patient, as I said earlier on, most research has shown that most of them, I don't want to say 100% of them lack magnesium. And not that they lack magnesium, magnesium is contributing to the problem they have in the ICU. Many of the disease conditions have been treated that are caused by magnesium are being treated with other medicine, other drugs. So, but for the general population, for the normal person who is healthy physically, I said we need to take intentional step to taking normal food that contain magnesium, seeds, nut, and all the rest. For those one, I don't think there's any quantity you can take that you have any issue. So, but if you now want to take supplement, normally for adult men and women, normally for me, I do recommend 400 milligrams for everybody. But going by the recommended daily allowance, for men, 400 to 420 milligrams daily, and for women, 310 to 320. Normal, that one can be taken for as long as you can afford it. That is number one. I'm talking about interaction. Magnesium normally is, if you combine magnesium with most of the drug, most of the nutrients, it's like magnesium is compatible with most of them. On its own, it tends to regulate calcium. It tends to regulate sodium within the body. Because intracellular, I think one of the reasons why you have high level of magnesium within the cell is to protect potassium inside the cell. So magnesium controls the entry of calcium and the entry of magnesium. It tends to maintain the ion potential within the cell membrane of the cell. So it controls magnesium and it controls calcium and controls sodium. With this, normally normalize them. So, but talking about other chemicals, other synthetic drugs, the issue is that it's not magnesium that is their problem. It is that some of them are problem to magnesium. For example, thiazide diuretics, they deplete our body of magnesium. Some of the anti-diabetics, they deplete our body from diabetes itself has issue with magnesium. Some of these drugs also contribute to them. So for all diabetes patients, you need to encourage them to take more magnesium, and you need to encourage them to, if they are taking drugs that deplete magnesium from the system, so we need to add magnesium to their medication. But for drug interaction between magnesium or most of these other drugs, it doesn't really have issue with them. I don't think I found any that you say that the only population that you don't prescribe the supplement for without monitoring are those that have serious kidney disease. And one thing is that Even those that have renal problem, that have kidney disease, need magnesium. It's only that we start with food with them. And we start with some control food, we measure their serum magnesium, and we tailor it alongside with them. But for the general population, everybody who can afford magnesium should try magnesium. Whatever, if you are feeling cramp, fatigue, and many others, even some people were having problem with sleeping. When you prescribe magnesium for them, you just see that this thing resolves naturally. So magnesium is a fantastic mineral in our body, in our system. So another issue you raised, Ma, is the issue of collaboration with, in my experience, it is some of the doctors, if you talk to them, they will reason with you, and I found some of them that are even prescribing this, but majority, I don't know, we can still maintain a rapport with them and relate all these things. But I believe that this is the area of pharmacists and nutritionists. If we let me say, equip ourselves with the knowledge, then with the little we can do, the next neighbor will gain from it, and the next physician will also have the knowledge that we have. Because if you have testimony, for me, I've been using many of these vitamins. If I am to talk about the work of vitamin D, you will know that all these are just blessings to human beings. They can help you prevent so many things. Vitamin C is exceptional. Zinc is there. And many of them, if you talk about all this, what is it called? Omega-3 fatty acids. If you combine all these things with magnesium, zinc, selenium, coenzyme Q10, all of them work synergistically, and they can help you prevent so many things, including cancer. So if we interact with these people, physician, and let them know the importance of this thing, all these things, you don't even need to convince them more. The evidence is there. They can make the research and see. So if you tell them and if they are ready, the research is all over. All this one that I mentioned tonight, they are evidence-based work that you can find. All my references are live references that you can go to, even the case. So I believe that with that, we will go a lot of way helping our patient and helping ourselves. Thank you, ma'am.
Thank you very much for those nice responses. I'm sure we all have benefited very well from your responses and the questions that asked questions. So thank you much, everybody, for your time and for being here tonight. Before we go, I briefly want to acknowledge Dr. Joseph Madu. He's the founder of CIFAN and immediate past chairman of the association. Thank you very much for being here with us tonight. We really, really appreciate it. So it's time to call the meeting to a close. And to do that, we would like to join Pamoma briefly in closing prayer. Pamoma, please, can you help us close the meeting with a short prayer? Thank you very much.
Okay, thank you very much for a wonderful moderation. Thank you, speaker, and thank you for our participants that were able to attend and endure the bad network with us. We thank you very much for coming. And to close, I want to say that God be with us as we all retire to our beds. We'll sleep well, we'll wake up well, no evil reports, no harm will come to us. In Jesus' name I've prayed. Amen.
Amen.
Everybody, I appreciate you all. Thank you.
Thank you, ma'am.
Good night, all.
Good night. Thank you.